Dr. Patino here at the Cosmetic Surgical Center of Cerrito. What are we doing now, Maria?
An extended abdominoplasty.
Extended abdominoplasty or an extended tummy tuck, and notice the complete absence of bleeding when we do these here at the Cosmetic Surgical Center of Cerrito. This is just incredible. It's a bloodless technique. We tell our patients, don't even look at the patients from before. Maybe go ahead and do so, but the main thing here is that we're gonna do this in a completely bloodless manner. Thank you. So the main thing is that we do this in a completely bloodless manner. And you may think, oh, you know what, they're just choosing the best patients. And that's why I say, you know what, don't look at before then. Look at after. Look at the patient that we're gonna do after this one, right? That's the way it is, you know, because we can do this consistently and predictably to the point that we can say, hey, you know what, we're very confident. With the grace of God, we can do this. It's a different technique. And it's a bloodless technique, and you can see it over and over and over again. And our patients are extremely happy. They are walking 1 mile the first day, 2 miles the second day, 3 miles the third day without pain, without bending over. The recovery is in days instead of weeks. That's huge, right? And there is no bleeding, so no anemia, much less risk of reoperation for bleeding, much less risk of a blood transfusion, a lot more energy that first day of surgery, so you can walk. When you can walk, you can prevent the most lethal complication, which is that of a blood clot. Incredible. Thank you. This is the belly button. We're going to go through the linea alba. This is the midline here. Welcome, Gabby. Hey, Gabby. Welcome back. Whoa. Gabby, my loyal assistant for many, many years, is here visiting today. How you doing, Gabby?
Good.
Oh, man. This is incredible. It's nice to see you again, Gabby. How you been, Gabby?
Pretty good.
You baking something?
Yeah.
What's going on? Tell me.
Got the bun in the oven.
You got the bun in the oven? Is it how far along are you?
25 weeks.
25 weeks. Big shout out to Gabby and her beautiful baby. What is it, a boy or a girl?
It's a boy.
A boy, huh? Wow. That's good, Gabby. Well, in good hour, like we say, buena hora, buena hora, buena hora. We say that in good hour. Very good. Well, it's nice to see you, Gabby. She's pregnant and working. You know, you can't, Gabby, you just can't stay away from us, huh? Huh? So, Gabby, hey, you miss us that much, huh? Yeah, beautiful. Well, we miss you. We miss you, and it's a pleasure to have you, Gabby. Look at this, huh? So this is a completely bloodless surgery, you know. Gabby, are you surprised that there is no bleeding?
No.
Why?
It's the normal.
It's normal, right? This is normal for us. How many years have you been with us, Gabby?
Gosh, I don't know, maybe like 14
years, right? Wow. Yeah, and she decided, you know, I'm gonna be a mother and stay at home with my family. That's a good calling, Gabby. That's what it is, you know. But we're welcome you here, you know. We'd love to have you. And that's your belly button right there. And yesterday I was teaching the Gabby. And yesterday, Gabby, I was doing a tummy tuck, and I was teaching the Gabby umbilicoplasty. This is incredible. So this tummy tuck umbilicoplasty. Remember how we used to do the hearts years ago, Gabby?
Yeah.
And people come from all over the place looking for the heart-shaped belly button. And Gabby said to me, you know what? I don't want the heart. If I ever have a tummy tuck, which she hasn't, by the way, she's still having babies. That's good for you. Not that you cannot have a tummy tuck if you haven't had babies. You can. Matter of fact, we have patients that have tummy tuck with us. They get pregnant, and I leave them so nice and tight that they don't even need a redo, right? We got a patient on TV that said, but you know, that's a sure way to mess up your tummy tuck, of course, you know, but it's a good way with having a child, right? Blessed by God and everything. But we had patients that, you know, I left them so nice and tight that, you know, they didn't need a tummy tuck afterwards, a redo, you know. So this is very nice. Thank you. How beautiful this is. This is just incredible. This is a perforator. There's a hole where that artery came out of, and we took it down, and without a drop of blood, right? This is incredible. This is another one right here. See? So there is, you gotta see them, you know, and you gotta be very attentive. You have to have a trained eye, be very attentive. But the beauty here is that this is bloodless tummy tuck. Is a very special technique that we have here, and it's a combination of factors, right? The most important thing is what we're doing right now, which is basically the operative technique, right? Because everything else, you know, every doctor knows, but the operative technique is what's difficult to do, to go slow. You need a very patient surgeon. You look at this blood vessel here. See, I can see it. Why? Because there is a contrast. So the vessel appears purple with a background of yellow fat. But normally, the average technique doesn't allow for that, because when you do the traditional surgery, all these would be stained by blood. So instead of yellow, the fat will be red. And so if it is all red, then you cannot see the contrast of the blood vessel. Therefore, you're gonna miss it. See, like right here, for example, this is a big perforator. It's coming up. I see it. I start electrocoagulating and up here on top, right? And now I can see the blood vessel retracted. See, it's up there now without a single drop of blood. But the normal thing that happens is that you go, oops, and that blood vessel starts pumping blood, and it's unnecessary blood loss. Unnecessary blood loss. That's what it is. And we do here an incredible bloodless. The typical blood loss with this procedure is about 2 cups of blood. And with us, it's a half a teaspoon. It's just incredible. And we just say a half a teaspoon, but there is really no bleeding at all. Occasionally, we do see a few drops of blood here, but it is just unreal. And it's not just one patient. It's basically a routine, you know. We did the similar surgery yesterday. Same thing, you know, no bleeding at all. And it's published, you know, we publish this on YouTube. So if you're interested, you can see many, perhaps hundreds. We have thousands, but they closed my channel. They closed in 2019. So whatever you got is from 2019, but still, you have hundreds of these bloodless surgeries, right? And we're not hiding anything. I teach doctors. Matter of fact, we're gonna have a workshop coming up. We're gonna do a tummy tuck. We're gonna do a transumbilical silicone breast augmentation, which is an incredible world discovery. I invented how to put silicone implants through the belly button. There's only 3 surgeons in the world. The first one to do this was Dr. Wang from China, and she asked me to modify her technique, and I did a completely different technique, and I improved the technique tremendously. She had problems with bleeding. We haven't had any bleeding at all, 0. She had problems with implant rupture during insertion. We have not had a single case of implant rupture, and the reason why is that she was advancing the implants with instruments, you know. She designed these instruments, very clever, but we do it manually. I figure, so in order to prevent the bleeding, what I did is I did the case with this type of anesthesia, which has epinephrine, right? And I also designed the tunnels to be, she has one single central tunnel, so I decided that to do the tunnels more laterally, so that there is less risk of bleeding and avoid the major blood vessels in the middle, right? So I went laterally instead. And in order to avoid implant rupture, I didn't use the instruments. I got her instruments, but I didn't use them. So what I did is I used, you see the blood vessel right there, and a perforator, but minimal, if any, blood loss. So instead, what I did is I advance the instruments with my own hands, you see? So my hands are soft. That's what we're doing here, right, Gabby? Gabby is retracting with her soft hands, right? I am also retracting with my soft hands. So there is basically minimal, if any, trauma, because sometimes, I mean, routinely, this technique calls for a cat-cow retractor. Remember that cat-cow retractor, Gabby?
Yeah.
Oh man, that thing is like a fork. It has like metal teeth that sink into the tissues, tear them, and make them bleed, and it's traumatizing to the tissues, right, Gabby?
Right.
I don't even know where that thing is. Do you?
No.
No, we don't. We haven't used it in many, many years, right? So we use this manual retraction, right? So same thing goes for the transumbilical breast augmentation. And the other problem she had is that the surgery would take her 3.5 hours. So she took a trip from China to see me. I was giving a conference about how to put silicone implants through. So I was teaching in Newport Beach at the American Society of Cosmetic Breast Surgery how to put these silicone breast implants, which I've been teaching since 2014, how to put them through an open abdominoplasty incision. So in other words, we would raise this flap all the way up to the costal margin, which we routinely do. In other words, we go up to where the ribs are, and then I would insert them from the inside. She sat next to me at lunch, and she says, Dr. Patino, I can do it through the belly button. I go, yeah, saline implants, right? She goes, no, silicone. I'm like, wow. So right by my side was the president of the American Society of Cosmetic Breast Surgery, and we were having lunch, and he was telling me that he was offering me to be president of that academy. And so I said, wow, it's a great honor. I didn't accept right away. I said, I gotta talk to my wife, she's gonna kill me. Because I got my hands full anyways, right? I'm already the CEO of the World Association of Gluteal Surgeons, and I'm busy, you know. But anyways, I said, well, since you offer, you know what, I want this young star to present her invention here. So we gave her a standing ovation in Newport Beach, and then I invited her to speak also at the World Association of Gluteal Surgeons in Miami with Dr. Miami, famous Dr. Miami, who founded this organization, right? And we're eternally grateful to my dear friend, Dr. Michael Salzhauer, probably the most famous plastic surgeon in the world in social media. Shout out to Dr. Miami. We love you, Dr. Miami. Anyway, so Dr. Wang did this impressive presentation. And the other problem that she wanted help with is that the surgery was taking her 3.5 hours to do. So on July 20th, and Gabby, you and I started figuring out, right, how to do this, right, Gabby?
Right.
Yeah, we got this, very expensive equipment, right, Gabby?
Right.
The video scope and all that, and I needed a long electrocoagulator, and I was concerned with the bleeding and all that, right? So I didn't want to do it. But the electrocoagulator was delayed in coming, and I am so impatient, you know. I said, the hell with it. I think we can do it with the tumescent anesthesia and the tunnels, and we had near zero bleeding, right, Gabby?
Right.
You were here with me, right, Gabby?
Right.
When we did that first case,
Mm-hmm.
and zero bleeding, and we did it in 55 minutes, right, Gabby?
Right.
Incredible. Thank you. So this is just incredible. So I was able on the very first surgery to correct all the 3 problems, and I was very honored that she trusted me. She said she's seen over 500 of my transumbilical breast augmentation videos and the transumbilical silicone breast augmentation, which she invented. She brought to me her discovery, hoping that I could help her, and I was thinking, wow, I was very humbled by the offer. I was thinking, no, there's no way I can do that. But with the grace of God, right, Gabby, we were able to do it. Yeah, she was right. she saw that I can do this surgery very fast and with the transumbilical breast augmentation very fast and without bleeding. And she figured, you know what, Dr. Patino can help me. And so I was pleased to do it, and the rest is history now. Since July 20, 2020, now we are on September 12, 2025. And I have a world record, which is we don't have a single case of capsular contracture using this technique with silicone breast implants. So this is just incredible. So we already published this. I presented this world discovery at the American Academy of Cosmetic Surgery in 2021, February of 2021. I think we did it virtually because of the COVID deal. And then Dr. Jacob Hayabi, my dear friend, gave me a call and he said, man, I told my fellow, I've raised this flap all the way up to the xiphoid process, which is the end of the chest bone raise, the chest bone there, the sternum, we'll call it the xiphoid process. But I want to show you inside, you guys. Tell me if there is any bleeding, okay? This is the belly button right here, completely bloodless. And what were you saying, Gabby?
You can see her, what is it called?
Semilunar lines, which is something that's incredible. So these are the athletic lines. This is the rectus abdominal wall muscle. Why can you see them, Gabby?
There's no bleeding.
There is no bleeding, so you can see these lines are usually not visible. And you can see them here, one here on this side and one on the other. Why? Because the anatomy is so perfect. This is how also I love this, because I've never seen stuff like this. Everything would be red. And so since I developed this technique in 2004, it's 21 years of bloodless surgery. Look at this. You can see the anatomy is gorgeous. Thank you. So what we're doing now is we're following this marked line, and I made a couple of them because we mark and then we redo things, right? But notice the complete absence of bleeding when we do this here, the Cosmetic Surgical Center over Cerrito. If you would like to have a procedure like this, please give us a call. This is an incredible technique. It's just obvious, right? The benefits are just obvious, right? Give us a call. Operators are standing by. 510-525-7999. That number again, 510-525-7999. If you would like to have a procedure like this, please call us. Thank you.
This is the specimen Dr. Patino just removed from the left side. As you can see, there's no bleeding. Okay, this is the specimen from the right side. Dr. Patino just excised. As you can see, there's no bleeding. Thank you.
Hey, what are we doing?
We're making the new home for the belly button.
Oh man, that's very good, Gabby. I was looking for the instrument, and Gabby had it already. Man, she's so efficient. Very nice, huh, Gabby? So what we're doing is, this is called de-epithelialization. This is something that we do routinely when we do a breast lift, for example. And here I do it for a different reason. I do it so there is no bleeding. And so this is incredible because as you can see, we go down to the dermis, and the dermis is an avascular, meaning that there is no blood vessels, or there's no significant blood vessels here in the skin, and so at the level of the dermis, and that yellow thing you see is the fat, right? The subcutaneous fat, right? And I'm going to leave a rim of that dermis. You see that white rim around it. That protects the skin also from a burn, because this instrument can burn. And so that's why Gabby is cooling the area, so that this is thermal energy, right, from electricity, thermal energy. And she's cooling it so that I don't burn the surrounding skin. And that's my finger. I love this part of the surgery. See, hello. 8 stitch. This is the first stitch that we do below the belly button. I'm gonna go slow so you can see. Look, wow. That is all that intra-abdominal fat. She still has it inside. So a lot of fat is giving her that look, of a protuberant, convex abdomen, right? But when we're done with this rectus plication, she's gonna be like that. So the rectus plication, the rectus muscles are the six pack. And these muscles normally are twin muscles that are joined in the middle, in the midline. And during pregnancy, these muscles separate, okay, to give room for the baby to grow, right? And now she's not gonna have any more babies, so we are going to basically put these muscles in the midline back together where they belong and restore her pre-pregnancy anatomy, right, Gabby?
Right.
And so this is a figure of 8. Normally with the typical technique, when you do these, there is a significant amount of bleeding. Every time you go through the needle, there is bleeding. Every time you go through the fascia with that needle. And so, but this is a unique technique. In reality, I've never seen any other surgeon do bloodless surgery like this in my life. Maybe they're out there, but I haven't seen them. And so this is an incredible technique. And we're gonna do 6 knots on this O-proline, and we already did the area above the belly button. Now we're doing the area below the belly button, and we're gonna then do a double plication. We're gonna follow this up with a running O-proline suture later on. Thank you. So now we're cutting with scissors basically the burn edge of the belly button, you see, and we're gonna make it a similar shape to what's in the outside, right? But notice how we do this with scissors, yet there is absolutely no bleeding. And I want to show you how this looks, right? Look at the belly button right here, and the rectus plication all the way up there above and below the belly button is a double plication. And how nice, flat and tight she is over here. Incredible. Thank you. Awesome. So we are done. Extended abdominoplasty, zero liposuction, bloodless technique. Look at the beautiful belly button sinking in nicely here at the Cosmetic Surgical Center of Cerrito. Thank you.